Hello, I'm Dr. Dennis McKenna. I'm joined again today by Dr. Fred Venditti, our hospital director. Today is Wednesday, March 18th, giving you the update from Albany Med. So today in Albany County, we're reporting out that there are 33 positive cases of COVID-19. Here inside the medical center, we have currently 6 confirmed cases. 5 of them are on a medical floor. 1 of them is in an ICU bed. We continue to have an adequate number of ventilators, and we have an adequate number of ICU beds to care for all patients who come in the door in the next couple days. At this point, we'd like to turn and do some questions that we got from yesterday. Dr. Venditti, why don't you start?
Sure, Dennis. So the question's been asked if non-essential staff can work from home.
Great. So at Albany Medical Center, we consider all of our staff to be essential. We have some, however, that are needed at the bedside, and the care that's provided by the others is essential. It just could be done remotely. Today in Cabinet, we were able to pass a policy that will allow us to begin to aggressively move people off of this campus. We also have put into place the possibility for some type of remote work, as well as changing in the hours that people are doing. There will be a messenger that will go out today to managers specifically about that. If you think you're someone who could work remotely, please contact your manager to talk about the next steps.
Here's another one. I understand the CDC has changed their guidelines on precautions. Can you get us up to speed on them?
So the CDC has changed their precautions. This is based on new information about COVID-19. The CDC is now aligned with the World Health Organization. What that means for us here is a change in the precautions from airborne contact to enhanced droplet contact. And what that means is the N95 mask is only needed for aerosolized generating procedures. If you have any questions about that, please reach out to our epidemiology department. But moving from the N95 to the surgical mask aligns us with the CDC and the World Health Organization, and will still keep our workforce safe.
And I can report to you today, we continue to track all of our PPE equipment, masks, gowns, gloves, drapes, and we have adequate supplies today. The sourcing group has done a tremendous job in that regard.
Thank you, Fred. Any update on the status of elective procedures here?
So we continue to meet daily at 11:30 to discuss the next day's cases. We want to be sure that we have all the capabilities, all the capacity that we need to provide safe care. So we run a list of all kinds of things, rooms, ICU beds, supplies, blood, etc., in making that decision. Today we added Dr. Megan Applewhite to the group, the Director of Bioethics, because we really want that thoughtful approach to what we're doing. So that group is talking about the next day cases, but we've also begun to talk about what we're going to do on a go-forward basis. That, we think, is very much going to be centered around the doctor-patient relationship, with the patient and the surgeon deciding what they want to do. We are actually starting to communicate with our patients, and I want to read this to you, that's why I'm looking at my phone. We want, and when we call them about their case the next day, we want to tell them something about COVID. So this is what we're saying to them. We are sure you know about the COVID-19 virus. Albany Medical Center is prepared to provide you safe care. If you have any concerns about proceeding, please call your surgeon to discuss it. Again, we want to point them back to their surgeon to preserve that doctor-patient relationship.
Thank you. In addition to the known cases in-house, the 6, we also have 16 that we're testing. We know that the availability of the testing kits is an issue. We still have our outpatient 10 open up. Can you give us an update on the status of that?
Absolutely. So the group has done a tremendous job, both the tent and the drive-through. Thus far, we have tested 1,402 patients that have come through those 2 facilities. Just amazing work. We are, however, beginning to get a little short on the testing supplies, the swabs, as well as the culture media. So we probably have several days worth left right now, but we may need to begin to think about curtailing sort of the walk-up testing that we've been providing. It's of value to the county, but we do need to be careful and protect our staff and the most vulnerable here in the hospital by knowing their status. So more to come on that.
Fluid situation. Okay.
Yes.
Thank you very much.
Yes.
So we end today by once again thanking you for everything that you are doing. We ask that you take care of yourself. We ask that you take care of others, and we'll see you tomorrow.